Hi, my name is Dr. Richard Menezes and this is Dr. Richard's Insights. Today we're going to talk about hemorrhoids. What are hemorrhoids? Hemorrhoids are swollen veins in the lower part of the rectum. These swollen veins can cause an outpouching or a bulge in the rectum, and if they are large, hemorrhoids can even come down into the anal canal where somebody can feel them. What are the symptoms of hemorrhoids? Hemorrhoids are usually not very complicated, are usually straightforward, but can be bothersome, can be troubling to most people. So they cause itching around the anal area. They can cause bleeding per rectum, which is passing blood while passing stool. This is a relatively common complaint with hemorrhoids, and it's quite alarming or frightening, and usually happens at the end of the stool, where someone notices bright red blood in the toilet bowl or on the tissue paper. It can also cause pain during defecation and may sometimes cause a swelling which can be felt by the person. So, how are hemorrhoids diagnosed? Now, if you have any of the symptoms of these hemorrhoids, it's advisable to go see your healthcare provider or doctor who will take a history and then examine the anal area using a gloved finger and a lubricant. Now, what I've seen is most general practitioners or most internal medicine physicians usually don't do this. Will usually give you the general advice that is associated with hemorrhoid treatment, and if it's not sorted by then, will refer you to a specialist surgeon. That's, I feel, completely fine because most of the anal or perianal problems may not be their expertise. After the surgeon examines the area, he will insert something called a proctoscope or an anoscope to visualize the hemorrhoids. Now, this is all that's required for the diagnosis of hemorrhoids or piles. So, what is the treatment for hemorrhoids? Hemorrhoids are most commonly seen in elderly patients or in patients that have chronic constipation or that push excessively during defecation or during pregnancy or after pregnancy, or very rarely can be associated with pelvic or rectal tumors. So it's not something to be taken lightly, especially if the bleeding is a chronic bleeding, that if you continuously are bleeding small quantities of blood with every stool and this has been happening for at least 3 or 4 months, it can be very concerning because you will be severely anemic. Okay. So what is commonly done in the treatment of hemorrhoids are some basic measures. First and foremost are lifestyle changes. So you need to increase the amount of fiber in your diet. The recommended dietary fiber per day is 25 to 30 grams. Now, this can be had through high fiber foodstuffs, it's fruits, vegetables, especially green leafy vegetables, also apples, bananas, oranges, or you can use a dietary fiber supplement. Now, these are commonly available over the counter, but it's best to read the instructions before use. Also, a common measure is to drink lots of water. At least 2 to 3 liters per day should be enough. Another important measure is to improve your toilet habits. So, you should not be spending excessive time on the toilet. You should not be straining while passing stool, or excessively straining or excessive force while passing stool. Don't take reading material into the toilet. Also, some people advise or some doctors advise using a step stool. This creates the position of squatting while sitting. It relaxes the anal muscles. Another simple measure is the use of a warm seats bath. A warm seats bath is nothing but soaking the rectum in 2 to 3 inches of warm water. Nothing needs to be added to the water, although some doctors recommend adding potassium permanganate. This has to be done 10 to 15 minutes per session, at least 3 times a day. It acts by improving the blood flow to the muscles of that region and relaxing the anal sphincter. Another common thing that can be done is the use of certain creams and ointments which will be prescribed by your doctor or healthcare provider. Now, these creams or ointments come with a nozzle and have to be inserted into the rectum, or some of them come with an applicator, which is like a finger glove. You apply it on your finger and then insert it. Now, if all of this doesn't work, the next step which usually your surgeon or doctor will recommend is something called rubber band ligation. Rubber band ligation is exactly what it sounds like. It's a small rubber band that is placed on the hemorrhoid. This constricts the blood supply to the hemorrhoid, and within 3 or 4 days, the hemorrhoid will shrink or fall off. Some patients complain of a little bit of tightness post the procedure, or a little bit of delayed bleeding on day 5 or day 6. Otherwise, it's a relatively safe procedure. It can be done in the clinic itself and can be done using lignocaine local anesthesia. Not very many risks involved. Other procedures that are minimally invasive involve the use of either laser or heat or certain chemicals like sclerosants that are injected into the hemorrhoid that cause the hemorrhoid to shrivel up, shrink, and then fall off. Now, if all of this doesn't work and the hemorrhoid is still troublesome, causing bleeding, causing pain, causing discomfort, or if the hemorrhoid is to begin with of a large size, then your doctor might at the outset recommend a surgical procedure. These are 3 types. Most commonly, what's done is a hemorrhoidectomy, in which the entire hemorrhoid is surgically excised. Other procedures involved a staple hemorrhoidopexy, in which equipment known as a hemorrhoidal stapler is used and fired inside the rectum. It provides a more cosmetic appearance, so to say, and hemorrhoidal artery ligation. Now, which procedure is best suited to you and to your needs will be determined by a conversation with you and your healthcare provider. This is all about hemorrhoids. In the next video, I'm going to talk about constipation and what we can do to prevent it. If this video was in any way beneficial to you, please do remember to like, share, and subscribe. Thanks for watching.